Good morning. My name is Theresa Gardner, and I'm here. I'm a family nurse practitioner at the Tribe, and I've been there for 31 years. And today I'm at the IGA where we're doing vaccinations for COVID. And over the week, we have a lot of questions about COVID. And one of the first ones is what are the after effects after I've had COVID? And some people go through COVID with no symptoms whatsoever. The biggest one that we see post exposure to COVID would be shortness of breath and fatigue. Those are the two biggest ones. Some have palpitations. Some people talk about head fogginess and just not feeling up to par. And that depends on how ill you really were with COVID. We've actually had to send some people to pulmonologists because of the shortness of breath. And really, when they do that, they have not found anything. So basically, we've been giving people inhalers to use, which seem to help. But it's just a time-limiting disease, and we don't really know how long at this point, just because we've not been into COVID all that long. But we do try to treat the symptoms, and that's what the specialists tell us as well, is to treat the symptoms, have people rest. Some people have even had to take some leave from work because of the symptoms, so we try to support them in that way. But it's really, each individual is individual about this post side effects. Now, also, after people have had their second vaccine given to them as well, they are also experiencing side effects, usually about 24 hours after. Some people say that they go to bed in the middle of the night and they wake up with shaking chills and a headache. And we are proposing Tylenol, that you take that as soon as you get your vaccine and keep taking it and see if that doesn't help it. Some people get some redness at the site on their arm, so we tell them ice and Tylenol. And the major symptoms post-vaccine are headache, chills, fatigue, and I can tell you that one myself, it was overwhelming, I felt. A sore arm, the symptoms are gone in 24 hours. That's the nice part. So post-vaccine, the symptoms are milder, and they're nothing like when you have had COVID itself. So I thought I would also talk about a couple of new guidelines that's out. So basically, the new one they're talking about is the double mask for people to keep people safer. And they're talking about wearing 2 cloth masks and trying to leave the medical mask to the medical people, as you know, what we call PPE, which is personal protective equipment for our nurses. Sometimes we have a really hard time getting that equipment. So if people could wear a double mask with cloth, that would serve as the covering that's required. The other thing that came out from the CDC was the fact that if you've had both vaccines and you're post-vaccine for 14 days, which your immunity at that point is supposed to be 94.1% if it's Moderna. If it's Pfizer, it's 95%. And the vaccine here that we're giving on the reservation here is 94.1 is the Moderna, which people have done very well with. But they're saying now that if you've had your vaccine for 14 days and you become exposed again, you do not have to quarantine. You still have to wear your mask, though. The mask is still an important part of that. They're saying that the immunity is for 3 months at this point. They're not really sure how much longer it is. You know that if you've had COVID, your immunity is for about 5 to 5.5 months, they're telling us. I think that sometimes people expect to feel better as soon as their 10-day quarantine is up. And I just don't want people to get that false sense of security. If you didn't have any symptoms, in 10 days, you're good to go. If you have symptoms, and we try to reach out to everybody, especially the ones that are symptomatic, and to make sure that you've got medicine that you use. You know, we're using the antibiotic Zithromax, we're using some prednisone, we're using some albuterol inhalers, and then the hard part is just people feel so ill they forget to use the medicine. So it's the importance of or isolating yourself if you're positive, and making sure that you're taking all of your medicine. I want to talk about the importance of the testing process, because people are not sure about the rapid versus the PCR. The PCR is the gold standard test. That's the test that we know to be 100% accurate. The rapid test is only in the 84th percentile, and it's only really effective for people that have symptoms. So if you're calling our clinic and you're saying, I was exposed to my aunt yesterday and I want to get a rapid test, that doesn't work. First of all, you have to wait the 17 days for incubation. And then once you get the 7 days of that your body starts to build up some response to your exposure to COVID, then we can test you. Many people get tested too soon. So if you're testing 2-3 days after exposure, that's just not an accurate test. And I know a lot of people like to go to Mountain Medical and do the rapid test. The tribe does not pay for the rapid test. They will pay for the PCR test. And that is also being done every Tuesday at the IGA for a while as well. So if you think you've been exposed, wait your 7 days and then get tested. Because otherwise, you're just going to have to do another test all over again. Now, if you're symptomatic, you need to call the clinic. If they have openings for that day, they can put you in. The other thing is that we're very limited on rapid tests. So we may say to you, it's full, and go to Mountain Medical and get tested. But that doesn't mean you go get a rapid. That means you go and get a PCR test. So hopefully that's clear on the testing. And that's what I have for today.